The Preimplantation Genetic Testing Program, PGT, which comprises of PGS, which is Preimplantation Genetic Screening, as well as PGD, Preimplantation Genetic Diagnosis, is a program that Ovation Fertility Austin has within the laboratory to allow us to identify not only the chromosomal normalcy of patients' embryos, but also if there's certain specific genes that we need to identify or genetic disorders that we need to identify per embryo. So the PGS program is comprised of embryos in which come from patients from advanced maternal age, as well as some of our younger patients, which want to guarantee that their embryos that are cultured as well as frozen for future transfer and ultimately transferred are chromosomally normal. So the randomized controlled trials, which have been previously published, do point in the direction that PGS does provide a higher implantation rate and altogether higher success by identifying which embryos are euploid or normal versus those embryos which are aneuploid or abnormal. We routinely do this testing at Ovation Austin. Each embryo is cultured to day 5, day 6, or day 7, where we do the trophectoderm biopsy, and that process is done by removing a small number of cells from the trophectoderm of the embryo. The trophectoderm will eventually give rise to the placenta, so we try to, or we do, not disturb the inner cell mass, which is the group of cells which will become the embryo proper. And these cells are taken from a specific embryo, and that embryo is numbered and frozen accordingly, and those samples correspond to that embryo. And those samples are then sent off for genetic diagnosis. Usually this is done at Ovation Fertility's genetic laboratory in Las Vegas. And within about a week, we get results as to whether or not the embryo is composed of the correct number of chromosomes or if there is an aneuploidy part of that embryo.